Presentation, we shall discuss a new drug, SOVATELTIDE, which is approved in India for treatment of acute ischemic stroke within 24-hour window. We'll be discussing its mechanism of action, indications, contraindications, dosage and administration, adverse effects, and evidence to support its use. There are two types of endothelin receptors, A and B. Type A receptors are found on vascular smooth muscle cells. They cause vasoconstriction and hence exacerbate ischemic injury. On the other hand, type B receptors are found in reactive astrocytes, Bergman glial cells, some neurons, and endothelial cells, and their net effect is vasodilatation, hence useful in ischemic injury. In addition, they also regulate differentiation, proliferation, and migration of neurons and glia. In adult brain, the dentate gyrus and subventricular zone have cells that continue to form new neurons throughout life. These may help in recovery from stroke. This picture shows the putative mechanism of action of SOVATELTIDE. It acts on astrocytes, unlike other neuroprotective agents which act on neurons. Activation of endothelin B receptors stimulates astrocytes to release several substances. One is neurotrophins that promote axonal growth and formation of new synapses. The other is vascular endothelial growth factor, which stimulates the progenitor cells to produce new neurons. It also promotes blood flow in ischemic regions and also has anti-apoptotic action. Sovateltide is approved for use in India for adult onset ischemic stroke within 24 hours window. The main contraindications are hypersensitivity to the drug, pregnancy, lactation, and age below 18 years. Available as a vial with lyophilized powder containing 30 micrograms of the drug. It is manufactured by Pharma's company and marketed by Sun Pharma. It is only for IV use and it is a single dose vial. Vial has 30 micrograms of the drug. It has to be dissolved in 5 ml normal saline and it should be gently swirled to mix the drug. With this dilution, 1 ml of solution gives 6 micrograms. There is a simple formula to calculate how many ml to inject. Body weight in kilograms divided by 20 gives the number of ml to be injected. For example, a 60 kilogram man needs 60 by 20, that is 3 ml of the reconstituted solution. It has to be given as a bolus over 1 minute. It should not be stored or refrigerated after reconstitution. The dose recommended is 0.3 micrograms per kilogram per dose given at 3-hourly interval 3 times a day on day 1, 3 and 6. That it is 80% protein, therefore it can interact with protein binding drugs. It is not metabolized in the liver, no involvement of cytochrome P system. Sovateltide is approved in India based on a single trial which is published in Drugs 2024 with Anil Gulati as the principal investigator. It is a randomized double-blind placebo-controlled phase 3 multicentric trial which is conducted across 18 centers all over India. Included 158 adults with ischemic stroke within 24 hours with 1:1 randomization to active and placebo groups, and the dose of sovateltide as mentioned is 0.3 micrograms per kilogram administered 3 times a day on day 1, 3 and 6. The study duration was 90 days. The results in this picture. There are two panels. The top panel is sovateltide group. The lower panel is a control group. Blue color indicates MRS 0, red MRS 1 and green MRS 2. So we can see that the blue, red and green bars in the top panel, that is sovateltide group, are much bigger than the same panels in the control group, indicating that more patients in SOVATELTIDE group achieved MRS of 0, 1, or 2 at 90 days. This translates to a 22% favorable outcome in the SOVATELTIDE group compared to the control group. Similar trend can be seen in NIH stroke scale outcomes. SOVATELTIDE group patients achieved better NIH stroke scale at 90 days compared to the control group. The absolute difference between the two is around 20% again. But the quality of life scale also, the difference in the mean score between SOVATELTIDE and control group at 90 days was 7.175 with a p-value of 0.0055, highly significant. The side effects, there are no major adverse events related to the study drug noted in this particular trial. There were 4 deaths which were considered unrelated to the study drug. Tilted has been used in India since its approval across the country. Some centers have used as high as 50 patients, and it is estimated that nearly 100,000 patients have received the drug across India. And there are efforts to collate the data and come out with a publication. Meanwhile, US FDA has approved a phase 3 study of more than 500 patients with stroke using SOVATELTIDE. If the Indian results are reproduced, the drug may receive approval in the Western countries in the future.